scoot over. If you want, yes, ma'am. Scott's not here.
He's got jury duty, so.
Let me scoot over. Well, I'm on TV.
Scott's,
I'll scoot.
yeah.
Well, my left hand is.
Scott has jury duty this morning, so he wasn't sure when he'd be, if or what, or.
Good morning, ladies and gentlemen, members of the public. I'd like to call the meeting of the Muscatine County Board of Supervisors to order. And I'll pull up my agenda here. Our chair, Scott Sauer, couldn't get out of jury duty this morning, so here I am. First item of business is to review the agenda.
Move to approve as presented.
We have a motion, is there a second?
Second.
All in favor?
Aye.
Aye. The agenda is approved. Next item is to receive comments from the public. Is there anyone, member of the public, who would like to comment on an issue not on our agenda? Seeing none, we move to item number 4, Information Services Update with Information Services Director Bill Riley.
Good morning. Just kind of wanted to give you a heads up where we were at with some of the stuff that had gone on at the city between October and now. We're still working with them on getting some things secured, getting everything going, testing remote connections for the deputies, so that hopefully we can be CJIS VIPS compliant for those connections. We're seeing what we can do with existing. If we're not able to use some existing hardware or software that we currently have, we do have a quote for something new that will be. And initial expense won't be that cheap, but then once we get into the maintenance portion of it, it's not horrible. So, but that's
Kind of what kind of ballpark, Bill?
for a 3-year maintenance contract plus the hardware, the initial would be about $17,000.
Okay.
And then after that, once we get into just the maintenance, it's about $3,000.
A year or every 3 years?
That would just be a per year, but we usually can get fairly decent discounts from this company if we do multi-year. So that's something that, you know, we will look at if we need to go that route. But if we can, we'll use existing until we can really truly budget and plan accordingly. Continuing to review, test existing security on our side, and to, you know, make changes where possible with as minimal of an impact on users as possible. We're currently working on securing up some authentication for, you know, email or remote connections. Again, we're testing and not trying to shove that down people at this point. So, but that adoption this morning seems to be pretty strong. So, going forward, we're going to be looking at using what is called a SIM, which is Security Information and Event Management, for a 24/7 monitoring of our more critical systems and basically the perimeter, if you want to think of it that way, to make sure that we're not, you know, being attacked, or if we are, who or what has been compromised. So that, you know, we can't review those logs 24/7, and so we will see how cost effective it is to outsource that. And several other counties are doing the same type of thing. Some are already starting to test these solutions.
Is that a service or is it a software solution?
It's a service. So they would provide us with some software packaging, potentially, the ones that I've talked to. And then that software would collect logs from our different devices, whether it be servers, networks, devices, firewalls, so forth, so on. And we would work with them to get it pared down to only the information that would be relevant to what we want to be monitoring. And then it would be sending that to them on a continuous stream every so many seconds, every so many minutes, and it's just small text data. So it's an encrypted stream, and then they would alert on anything that would be considered critical, or whatever level we want them to do that at. And generally speaking, it's going to be based on the amount of data that you're sending them. So talking with other counties, looking at the number of devices that they're monitoring, roughly it's something I'm gonna put in the ballpark of $9,000 to $10,000 a year. But again, it all depends on how much you're monitoring and how much data it's constantly sending them. So again, we're just starting to look at this, so. Because the state does provide some of these types of resources, but they're not 24/7, and there's only so much they can provide, so. Beginning in November, we did move back to the old help desk software, because what we've been using for the past couple of years, we were finding out more and more that there were tickets that weren't getting sent out of the system, so we weren't being notified. During the day, during the week, that's not such a big thing, because we usually have a browser open and we can see when those are coming in and so forth. But after hours, there were times where we weren't getting notified, say if the jail was having a problem, or if somebody was opening up a ticket, you know, say after 5 o'clock. So, without having a continual connection to that through our phones, through our home computers, what have you, working with support, it was an issue in their system, but after several months, they hadn't done anything to resolve it, so I figured it was best for us to move back to something that did work. So far, so good, you know, first month testing. So the reports will look different, but, you know, we're still working on trying to get them to look as close to what the other ones did as possible.
I noticed your response times increased.
Over this past month, yes.
What was that due to?
Honestly, I can't tell you without digging through everything. I think some of it is that in the new system, we're not able to, say you submit a ticket and we call you right away, as opposed to emailing you and say that we'll call you. Well, we call you, we talk to you, and say it takes an hour to get it resolved. Then we update the ticket. There's no way for us to go back and alter that to say that we contacted you at such and such a time and change that time on the ticket, which we were able to do in the other system.
Well, I don't recall, I mean, previously it was on the old system, time running this far out.
Right, but on the old system, we were able to go in and change the time of our initial response, so that if we called you immediately after we received the ticket, and we didn't update it right then and say, we will call, we were updating it, you know, we would be updating it an hour later. So now you've got a 60-minute gap as opposed to a minute or a 3-minute gap, which has an impact on that, but we may see that change as we get used to the new system. So, other than that, we worked with the auditor's office for the elections, laptop setup, cloning, so forth. Leslie would have to let you know how well that went or didn't go for us, but.
No, it went pretty well. I mean, we had a rough first election, just getting it all done, but I
Right.
think we learned a lot, and we did get it all done, and I think we've learned a lot for the future for
Right,
how to.
I think, you know, some trial and error on the first
Yeah.
side of it,
Yeah,
trying to
but I
figure out what
thought-
the best cloning solutions were, how to
Yeah.
do that, how to get them updated, and.
This was to deploy all updates to all your
Right.
worker laptops at
Yeah,
one time.
all 54
Create a
laptops,
clean
yeah.
copy and then get it done
Yeah.
across 50
Right.
computers in
Yeah.
a timely manner.
Right, and they have multiple models at this time, so we were having to create multiple images,
Right.
so.
Oh,
Because we have multiple, over the years, versions now. We've replaced a bunch last year, we'll replace a bunch more this next year. That will help a little bit. We'll still have a handful of other ones. but
Right,
Every time you buy something a year later, you end up with a different
right, everything's
version.
gonna have to have a different image at that
Unless you
point.
buy them all together at the same time, you're gonna have that.
yeah, that's not gonna happen.
No. So we always have to work with that.
Towards the end of October, we did have the backup internet connection installed and running. We unfortunately had to use that a few times, but that is going, it's currently set up in a load balancing failover configuration, which does work, fails over relatively quickly, minimal downtime, but we're still looking at any type of solution that we can use that sits outside of our firewall that if we do fail over, it's transparent to any of those services that rely on our primary internet connection or connectivity to and from the county. Something, just as an example, I don't think that it's related to it, but EDMS, the State Document Management System, that if they relied on that external IP from MPNW always being the same, if we were failed over to our backup for a day or a week or something like that, none of those connections are going to go through. So we're going to need something that emulates the same address all the time. So, but those are things that we're looking for. We will budget for them. We're not going to try to go out of cycle or anything like that. So, we have the managed printer solution implemented and working to get all that running smoothly, but I believe so far it's working well. So, and costs are down compared to what we were spending on just donor alone before. So.
And who's doing that for us?
It's Advanced Business Systems out of Quad Cities. So,
So Bill, all this talk you're doing this morning, it sounds like you may look at an increase in your budget this year.
don't know. We'll have to wait and see.
You're throwing out a lot of new numbers.
No, the remote connection for the deputies, I don't know what line item that's gonna come out of. I don't know if that's an IT related expense or if that's going to be something that would fall under, say, the Muscatine expenses. Because that's something that's currently, or had previously been handled by the city or through Muscatine. So, I don't know how that's all going to work out. Those are things that we need to have discussions on. We need to discuss with Sherry and with Nancy as well. So.
We can see.
Right, and I think we had some extra things in this year's budget, so it may not be a large difference. We still may see a reduction. So,
Very good.
other than that, did you have questions on?
Well, I just had a couple questions on the previous, you'd sent out some others.
Helped us.
Previous months.
Mhm.
It looked like the jail continues to be like the bulk of your business. And
Right.
But I saw a lot more software issues in the last couple of months, I thought, than I typically would see. Usually it's email and connectivity, those are always up there, but I saw software problems, is that?
We've had some problems due to the issues at the city between the jail and Muscatine. We've also had some software issues due to internet outages, where we had some things that weren't working correctly on the backup connection. Hence the possibility of having to move to something that always emulates the same IP. So, we've had some software updates, and with the changes in the security that we've put in place, it has impacted a lot of the stuff at the jail, just because we're having, instead of having a wide open field between the two entities, it's now narrowed down and you can only go through certain doors, so to speak. So some of that is just us having to make tweaks and reconfigurations.
And with the issue that happened at the city, did they ever really narrow it down to exactly what happened, and have we closed that door, or are we still?
I don't know. The last I knew that they were working with a consultant. Other than that, I am not aware of anything else. So, I don't even know where to direct you on that, or if they're still working with consultants to get this, all taken care of.
I feel a little uneasy that we're not sure if we're vulnerable, because we really don't know what happened.
Well, and again, we've tried to lock down as much as possible. Basically, the one gateway that we had between us, it used to be open. Now traffic coming from that direction is pretty much non-existent unless we initiate it. And we're only basically allowing about 5 holes in our connection from them to us, or from us to them. So we are limiting that as much as possible. We're doing everything that we can to make sure that all of our devices are updated. We're making sure that all of our software is updated. Reviewing all of our firewall policies to make sure. We will work on doing some penetration testing with somebody at some point in the near future. And, I mean, these are all the things that, you know, we're supposed to be doing, so. Yeah, and I mean, I can't tell you anything that was going on at the city prior to that. I don't know what their patching schedules were. I don't know anything like that, so. We're doing what we can, and we have layers and protection in place that they may or may not have had, so.
Maybe we should ask for a report.
Yeah,
All they can do is refuse it.
yeah,
I think it's in our interest to really get a handle on it.
yeah, because we're kind of, you know, we're interrelated or we're tied
Right.
together, and it'd be nice to know, you know, exactly what did happen, so we make sure we're not
Right.
vulnerable.
So,
Is that something you can outreach on, or we need to, as a board, ask for that?
I don't know. I've offered to, you know, provide any information and the insights on things that we're doing. And I've had some responses and so forth, but again, I don't know where they're at in that process, and they might not be willing
Sure.
to do that at this point, so. I mean, I have no problem reaching out to them, but again, I don't know that, what their policy would be.
No, I get it, but I'm with Jeff. I think it's hard for us to do our job if we don't know what we're doing, if we don't know what we're dealing with.
Why don't you reach out, Bill, and if you need more oomph, we can.
Right, no, and
On that, yeah.
I will see what I can find out, and some of that we may want to discuss more in a closed meeting as opposed to an open, just because
We
if
need
it's,
to be sure.
yeah,
Sure.
security related items. So,
Anything else for Bill? Thank you, sir.
well, if there are questions, let me know.
Thanks, Bill.
Item number 5 is a community services update with Community Services Director Kathy Anderson-Noel. Good morning, Kathy.
Good morning. How are you?
We're doing great.
All right. Well, in your packet, you know, basically where we're at right now at the end of November for the mental health budget, we're at 29.56% with a target of 41.67. We have received 2 payments of 190,202 totaling 380,404 from the region. We're scheduled to receive 2 more. So budgetary, you know, in the budget, we're doing fine. Our general assistance budget, we are currently at 39.28, so we're a little closer there with a target of 4167. And we're at 179,806. Some things going on with the region. We've been involved with strategic planning. Nathan's been involved with that. The governing board and the management team both met separately last Thursday, and we are going to be meeting as a whole group this coming Thursday on the 13th. So some of the items that we're looking at, you know, are expansion of our trust program. We're looking at reviewing our guiding principles of the region, which were established when the region became a region back in 2014. And, you know, reviewing those to make sure that they're still valid. Just trying to move forward as a region. Thinking about money, thinking about budgets, all those good things, how we work together to see if it's okay if each county has some different types of services than other counties, as long as services are all available within the region. And that kind of speaks back to our trust program. Legislatively, there's a lot going on. Lori Elam is going to be meeting with the interim legislative committee this week, and I've got a handout that I can give to you that has her PowerPoint presentation there. I think Nathan, she shared that with you as well. And a lot of it's really focused on the funding streams, how we're gonna be moving forward with a mental health system, especially if they introduce children's services into the mental health system, which, you know, they've said that that's going to happen. And regional governing boards are gonna be responsible for implementation of that. Now, they're looking to other funding streams, some Medicaid funding and things like that. But the concern that we have, again, is you've got some legislation, but no funding stream to follow it.
Is that why you're looking more strongly at expansion of the trust program?
Not necessarily. We have, right now, we've served a few children, but the majority of our program is adults. And the reason that we're looking at the expansion of that is, we are really at our max capacity with Muscatine County. The other counties in the region don't really offer much in the way of these services. And, we have a long history of doing these services and doing them quite well. And, we've taken on a few cases from some of the other counties when, they've had some staff leave and that. And, Jackson, Clinton, and Cedar aren't taking any type of new cases. As far as guardianships and conservatorships, we do the lion's share of that work. Right now, we're mainly Muscatine County. We've just got a few from other counties, but, Lori Elam currently does 29 guardianships, and she's not going to take any more. We get calls on guardianships every month, so, we're looking at how can we be able to be the point for those services within the region, because I think we've got the best established program.
But isn't that program one that we can actually create a little revenue stream from?
We can, and, I've got some proofing to do with my business plan for you, and you'll be receiving that. I wanted to get through our strategic planning session before I submitted something formal to you. And so, we do have a service rate for those, which, we can currently charge if we're doing that for someone else. We're not going to do it for anybody outside the region. Although we do have some cases, if you remember back in the mid-2000s, the turkey farm people, and we've been instrumental in working with some of those folks, and who now live outside the region. So
It's what, $41 a month we can charge?
it's 41 that we can charge Social Security. We can charge the individuals, and that comes out of their Social Security benefit.
Right.
And we also have the capacity to waive that. If somebody is very, very tight in their budget, we can waive that. Now, we currently charge $39. So that's something we want to look at. Do we increase that to $41, which we can? But the other piece that I was referring to is basically what our unit rate is. And so that means, the total cost of our program divided by the number of participants, working out in a monthly rate. And so if we're doing all three services, and we include a service management piece in there, which is, similar to case coordination, that allows my staff to attend planning meetings and things like that. So, the actual cost per person is $173.45 per month. And if we break that down, the service management piece is $68.76, the conservator guardian piece is $52.70, and the representative payee piece is $51.99.
That seems somewhat in line with what other folks are charging.
Right.
Yeah. So
So we're just defraying the costs, we're not
yeah.
generating revenue per se.
No, but
No,
you could actually
and it
pay
wouldn't
them.
be really a revenue generator, of course, but it will help to defray our costs if other counties
Well,
are
I'm
paying
sure you're
into
running the
this.
same problem others are running into, because you mentioned about the legislator mandating but not
Oh, sure.
funding. So they're expecting you or us to come up with a funding source. for that.
Right. And, that's not just the children's services, that's the other core services that, 2456 has put into place. But moving ahead, we've got some services that are coming down the pike, and we've got expansion of mobile crisis, which should happen early winter of 2019, so probably around February. And that's a loose estimate, but we've also got the implementation of what's called a warm line, and that's a peer-run service. It's available 7 days a week from 5 to 10 p.m., and the number is 844-755-9276. And what that is folks with lived experience with mental health. Person can call them and talk to them, and just really share. They can share their experience. They're not going to do any therapy, counseling, crisis management. And in fact, if it is a crisis, they're going to tell the person they need to call the crisis line, which is another number. And we've had that number out there. I mean, just for information, it's 844-430-0375, and that's the crisis line. And so, but you know, sometimes people don't really have a crisis, but when you're dealing with mental health issues, oftentimes it's helpful to talk with people that know what you're going through. You know, the general public, or maybe a family member, you know, may not understand what the person's going through, but somebody that's dealt with that will. And so that's the purpose of that peer-run warm line.
And Kathy, is that warm line confidential?
Absolutely, yeah, absolutely. Now, of course, if somebody, you know, talks about maybe hurting themselves, I think that, you know, that confidentiality, danger trumps confidentiality always. So, you know, they're going to do their best to make sure that they're connecting the person with, you know, immediate assistance. So, but yes, it is confidential, and the crisis line as well is confidential. You know, mental health services are highly confidential. One good thing I'm able to report is the ACT team that I've talked about before, that the region has done some funding for on the one-time funding request, is they are now serving some folks here in Muscatine. They're already serving at least 2 people, with probably another 1 or 2 in the works. And so that is a service that's more intense than integrated health service, more intense than traditional supported community living. They have contact with people at least 5 days a week. It can be phone contact, it can be in person. And the folks that we've been referring are folks that are traditionally not successful with other types of service. These are your high needs folks, the folks that are going to be calling me, maybe even calling you, you know, because things are not going right in their world. They've been traditionally folks that, due to their illnesses, are often resistant to service, maybe mistrustful of service. And so these ACT workers are highly trained and able to really break down some of those barriers and establish relationships, because we know establishing relationships are critical when you're working with people that you're trying to help.
And Kathy, for the folks who don't know all the alphabet soup, could you explain
Okay.
ACT? And
Absolutely.
That's run through Vera French, correct?
Yes, it's run through Vera French, and that stands for Assertive Community Treatment. And it's actually been a model that's been around for quite some time, you know, even back in the 90s, and it's been very successful. It is an intense service to run. Vera French got a one-time funding grant from the region. They do accept Medicaid funding, you know, to offset, but the Medicaid funding, of course, that they get for providing this service doesn't cover their cost. As, you know, classic story. But, you know, on that note, I am happy to report that a situation, you know, that Representative Carlson's been involved and instrumental in working with in our own community regarding a provider and an MCO. Looks like there's been some resolution to that. The state is now looking at, for supported community living services, which is SCL if you want to do the alphabet soup, daily rates. They're looking at those in the higher tiers, which are your higher needs folks. They have raised those rates for providers so that they're going to be able to provide the services to those that have the highest level of needs. Now, in order to do that, they're kind of taking away from the bottom tiers, your 1s and your 2s. But it is a solution for now. So the situation that, you know, we've been dealing with has been somewhat resolved, and we'll continue to keep tabs on that. But, you know, our intervention with our legislator, has been instrumental in helping that along, and I think the folks that are involved in that setting are very grateful for that intervention.
Representative Carlson's been a good friend of mental health.
He has.
He's been very, and I think he's meeting with
He's
CEO
meeting with
Eaton.
Lori today.
Was it today already?
Yes.
So we thank him for that interest.
Right, and I had a conversation with him last week as well, and, you know, he is very involved, very interested, and, you know, we're fortunate to have him representing us in those areas. And I think he does, you know, in conversations we have with him, I think he understands, you know, the issues at hand, and I think he's got a real sense of empathy for the folks that are dealing with that. So, we continue to see a lot of commitments. We had a little lull in October, but now we're back up in November to 23 commitments. Of those 23 commitments, 7 of them did go out of region, but 3 of them went to the university. So, you know, that's not a big deal. We did have 1 go to Council Bluffs, 1 go to Carroll, 1 went to Cedar Rapids, which again is not a huge deal, and 1 went to Sioux City. Interestingly enough, we didn't have any that went to Robert Young's, which means that they were probably full at the time. But you know, we're working to get those out of counties.
We were hoping we wouldn't have to send them to the West Coast.
Yeah, exactly. You know, we still send a few to the West Coast, but again, that's on everybody's radar. You know, not much you can really do about it when there's a lack of
No,
beds.
they always seem to have something available to them.
Well, you know, I think if you probably, and I don't have numbers or statistics on this, but I'm guessing a few come over this way from that way too. It's a matter of when you need the bed, where the bed's available, and, you know, it's nothing you can really predict, unfortunately. I have continued to meet with the crisis system staff through the Robert Young Center, and got a little bit of good news from Penny West. She has interviewed some candidates for some of the open positions through the crisis system in Muscatine, and that would be the Justice Involved Care Coordinator and the Substance Abuse Care Coordinator. Now, I've not heard of anybody being offered a job or hired as of yet, but I've continued to poke at them because Muscatine and Cedar County, we haven't had any staff. The other counties have had some staff, and they've had some turnover too, because these are difficult positions to fill and to find, and then apparently somewhat difficult to keep staffed. So they do require master's level licensure. You know, if we look at the job market in general, we know that finding good qualified people, it can be difficult in any industry. And so mental health is no exception. Our prescriber bridge appointments, they're continuing to be well utilized in Muscatine. Unfortunately, we lost our 100% attendance status, but we're at 75. So they had 1 miss. And so, you know, they had 4 appointments scheduled in September, 1 miss, so we're down to 75. But we are utilizing that service, and our telehealth figures are still high. We had 29 telehealth evaluations done in the emergency department in September, and Robert Young's statistics are right now only through September. They're a couple months behind. So, where we're at with general assistance, we are still showing a lot of need through MCSA, and I've been meeting regularly with their staff, trying to figure out where folks are coming from and what's happening, because we paid for 39 unduplicated households in November, and that means what we paid for in November, not necessarily how many were served in November, although that number was pretty high as well. We reported 62 households, but those are duplicated because we screen them twice a month for eligibility to be at MCSA and cost shares and all that. So, you know, a lot of people are experiencing, you know, what we call a hiccup. You know, they may lose a job, they may get sick and not be able to work for a couple of weeks, they may have a situation where they're pointing out and losing their job because they can't get to work. Maybe it's transportation. There's a lot of little factors that go into people getting to the point where they need to go to shelter. And the news, you know, the good news is we do encourage people to go to shelter rather than to couch surf or trying to live in dangerous situations. We encourage people to go to shelter. They're also reporting more families in shelter right now. They've currently got 30 children at MCSA right now. And, you know, moving into the holiday season, that's a bit concerning. Excuse me. Sometimes you see a little bit of, you know, a lull, but, you know, we've continued to see high utilization. One thing we do, you know, if somebody's coming in from outside the area, they're considered a transient. And so the limit of length of stay is 7 days. So, you know, we're not importing a lot of people to come in and stay at MCSA. It's usually things like somebody's gonna have their utilities shut off, and so that renders their residence inhabitable, and the city will post it, you know, so they can't stay there until they get the utility situation involved. Sometimes, unfortunately, the utility situation is so out of control it can't be resolved. We encourage people to get in as soon as they start having some difficulty and come in and talk to us. You know, we have limits as to what we can help with, and you know, we can't help when the bills are in the thousands of dollars because it's just too far gone, so that often necessitates them having some time at MCSA.
Kathy, I'm assuming that MCSA maintains some type of informational piece on these folks that stay there, so that maybe we can get a handle on why
Right.
they ended up there, and maybe we can address the core problem.
Exactly.
So, but I've not seen any of that really given to us in the past.
Right.
Other than when MCSA comes before us.
Right. And we're working on trying to put together some good informational reports. You know, they've had some changes in their management, you know, over the past few months. And I just actually met with Angela, who is a program manager. And, you know, I'm talking with her and with Scott about, you know, how can I get some good information? How can we track this? And you know, a couple things that I'd really like to track are how many people that stay at MCSA actually working. And it's about, you know, from rough figures that I've done, it's about 35 to 40%. So that's a pretty high number if you think of a traditional homeless shelter.
Oh, absolutely. You'd think,
Yeah.
why are they there?
Exactly. And, you know, some folks are on disability, some folks have nothing. But, you know, you do get a lot of folks that are working like your lower end jobs, your entry level jobs. They might be working a couple of jobs. And again, some of those jobs don't have things like sick benefits, vacation time off, and, you know, if your child gets sick or if your car breaks down. And so a lot of people are choosing between fixing the car, paying the bills, getting to work. You know, it's all those choices, and you know, I've referenced the Alice report before, and that information is pretty helpful in understanding some of that. And you know, these are things the community in general is trying to figure out. I think society in general is trying to figure out, and it would be great if there were just one answer, but there's not. There's a million answers.
Well, fortunately, Muscatine community takes big interest in that.
Absolutely, and we've got a lot of
involvement, charity giving.
yeah, we've got a lot of great resources within the community, and we're fortunate that way. So I do have a handout for you, and this is what Lori is going to be presenting to the Legislative Interim Committee this week. This is her PowerPoint, so you already have it. And there's one for Scott.
Thank you.
Okay, you're welcome. And, you know, budget-wise, I met with Sherry on Friday, and we're reviewing some of the budget process, and Lori Elam and I are going to meet later this morning to talk about how Muscatine's budget fits into the regional budget. So, do you have any further questions for me?
Anyone? Thank you, Kathy. very much.
Okay, thank you.
I'm going to take this opportunity to make a plug for the warm line and the crisis line. I hope our friends at the Journal will be kind enough to reprint this information. If you need to talk, it's not an emergency. The warm line is available 7 days a week, 5 to 10 p.m. at 1-844-775-9276. If there is an emergency, you can call 24/7 at the crisis line, which is 1-844-430-0375. So bear that in mind, folks. It's a great resource. Next on the item on the agenda, we have Planning and Zoning Administrator Eric Furness. Morning.
Morning, Eric.
Item A, just have one special use permit to review that was granted by the Board of Adjustment. Special use permit for a rural residence was granted on 181st Street. This is kind of a dead-end gravel road that runs up, just best to describe it to you. It runs up kind of behind the grist mill, up behind Wildcat Den. There was some property up there that was divided a couple of years ago through a family estate, and one person applied for a special use permit, and I was granted to build one home up there. The other issue for your review, this is kind of atypical. We don't have these very often. Board of Adjustment was asked to consider the release of a restrictive covenant on a piece of property on the north side of Highway 6, right out by the Johnson County line. The reason this was in front of the Board of Adjustment was the restrictive covenants that used to be required on farm property for years when the owner wished to split off the existing farmhouse always contained language that said they will run with the land and remain in place until they are released by the, quote, proper zoning authority. That's not really clarified anywhere. Some counties, the zoning administrator handles that administratively. Some counties, the Board of Adjustment does that. I've always felt more comfortable with the Board of Adjustment being able to have a public discussion on that. We also have the opportunity then to notify surrounding property owners of that petition. So Board of Adjustment heard one of those requests from a person who had bought a portion of a large farm estate, and this person would like to submit a farm exemption. He is actively engaged in the farming of that portion of the property. He'd like to submit a farm exemption to build a house. I don't believe I would be in support of recommending a special use permit, but since this case involves someone wanting to submit a farm exemption, I believe it's still been consistent with our comprehensive plan to only allow development by farmers in that area and retain agricultural activity. So that was my recommendation to the Board of Adjustment and why I felt that it was consistent with our plan. And they did release the restrictive covenant on this portion that this particular farmer owns. The rest of the estate that the restrictive covenant had been covering from the previous owner still has the restrictive covenant on it. It's just this portion that this person now is involved in farming. It allows him to submit a farm exemption to us, essentially. So just for review.
Was this in a trust, or why was the covenant on there to begin with, or do we know?
Prior to December of 2015, that was a requirement when if you owned, say, 160 acres that had a farmhouse, an existing farmhouse on it, and we know farms have gotten larger, smaller farms have been bought up. So what we see happening is a large farmer buys another 160, 240 acres, and there's an existing farmhouse. He has no need for that farmhouse. He lives elsewhere. He just owns a lot of ground. You were required to put a restrictive covenant on all the rest of the farm ground if you wanted to split off and just sell that house to somebody not related. In 2015, the Board of Supervisors, upon the recommendation of the Zoning Commission, repealed that requirement to put a restrictive covenant on there. Because we still have adequate protections within our zoning ordinance that would, you can't just go build residences. So something that we really felt wasn't needed anymore. But that was a requirement at that time, Matt, when the previous owners wanted to dispose of a farmhouse that they didn't need anymore. So that's why it was put on in 1999. So this is just for your review, just like special use permits. I plan on continuing to just utilize the Board of Adjustment. We should see less and less of these since they're not required anymore to split off. As you'll recall, now to split off an existing farmhouse, it just has to be at least 5 years old. And then it can be split off. Some of them may still have to go through subdivision if it's been, the quarter's been split before. Many of them are just a simple plat of survey, create at least an acre around, but it has to be 5 years old. And just a reminder, that's to just prevent farmers from abusing the farm exemption and creating a property, flipping it, and then going over to their next 40 and doing the same thing. So those were the two actions of the Board of Adjustment. No action needed from the board on that. Item B is approval of a combined preliminary and final plat of Gander Ridge subdivision. It's a 3-lot subdivision on North Tipton Road, just north of the bypass. In fact, a large portion of this is in the city limits. It's going through simultaneously through P&Z and City Council as well. There was 3 tax parcels there. It's been divided up on this plat into more logical lots, only 2 of which are actually buildable lots, one of which already has a house on it. The other one is marked Outlot A on the proposed plat. It's behind a large creek, much floodplain. It's not reserved. It can't be built on. And that's actually in the city anyway. So it's just, the whole purpose of the subdivision was to create more logical boundaries that would allow for some sale of this property. Like I said, one house, there's already a lot with a house on it. But at the end of the day, this is right within the area where we would expect growth, right next to the city limits. It's been zoned residential for years and years, so pretty simple.
Entertain a motion to approve.
So no. Second.
Okay, this is a roll call vote. Bob?
Aye.
Matt?
Aye.
Jeff?
Aye.
And I vote aye. Motion is approved. Anything else, Eric?
I don't believe so.
All righty. Thank you, sir. Item number 7 is discussion and possible action to approve an ordinance repealing ordinance 03-26-18-01 and establishing a local option sales and services tax applicable to transactions within certain incorporated and unincorporated areas of Muscatine County for the period of July 1st, 2019 through June 30th, 2034. This is the second of 3 readings.
So moved.
It's
Second.
moved and seconded. This is a roll call vote. Matt?
Aye.
Jeff?
Aye.
Bob?
Aye.
And I vote aye. It is approved on the second reading. Next up is discussion and possible action to approve the minutes of the December 3rd, 2018 regular meeting.
So moved.
Second.
All those in favor?
Aye.
Those opposed? Motion passes. Correspondence, we'll start over on your end, Matt.
I think we all got the email, on the condition of the 152nd. And, I have not responded to that email because, for one, you did, Nathan, and I think you did a good job explaining it. The other was, I've been doing some work, with Keith, trying to get a little more information, before I address it, and I'm getting close, so
Jeff?
Yeah, I received the same correspondence on 152nd, and I'll note that, you know, in the correspondence, she indicated that, you know, it was just a section of 152nd about the last mile, and, you know, I think that's an area that's quite complicated because I've become aware now, I guess, that in the seasonal cottages down there that we have people that are full-time residents apparently. And I think that's an issue that this board's gonna have to think about long-term because we don't set road conditions and we don't treat those areas the same, I guess, always from a road perspective as we would other areas. So I think that's you know, kind of goes to the unincorporated township issue that we've had here come before the board a number of times where we have expectations of county roads beyond that of the farming activities. And we don't collect taxes for that, we don't do that. They're not supposed to be living there, but apparently they are. What is this board gonna do about that, and how are we gonna deal with that issue?
that was another thing that I was gonna look into with the assessor's office is, I was only aware that there was maybe 1 or 2 permanent residences down there, and in the email, it sounded like a dozen
14,
or more.
yeah.
So I was gonna look, into that in the assessor's office and see, if in fact, they're collecting for full-time residences down there, and how many, and if not, maybe we need to get it changed.
Yeah, cause that, you know, that was a question I had asked to the Eric and P and Z a little bit, and I think there's, you know, after 2008 floods, you know, we issued a lot of rebuild permits in those areas, and there was always quite clear in those permits that these are seasonal cottages, not for full-time residents. And, you know, the road expectations should be a bit different. And again, you know, it's, you know, if you read about stuff, most of the issues in that last mile are washboarding, and I'm not a road guy, but everything I read, you know, I read through the EPA and the all the directions, and all of them talk to washboarding as you know, has to do with moisture and speed. You know, what do they say? If you go over 3 miles an hour, you're creating washboard. So it's gonna happen.
Well, the bigger problem you have is what you previously mentioned, is the fact that you have to be so careful regarding precedent when you have the seasonal expecting the services of a homeowner. It's different, and if you're gonna treat one way, you gotta treat them all the same way.
Well,
So it's a
honestly,
bigger
Bob,
issue than just one road.
that section of road, I feel, the board should look at it very similarly, to how we look at Edgewater. Because that is essentially how we have that, zoned or permitted as seasonal. And, I can tell you that there's been a lot of money, if you were to take, and I'm working on these numbers, so hopefully I'll have them next week, but if you were to take a 1 mile stretch, or an average of what it would cost across the state of Iowa, I'm working on that number, for a secondary road, and then what an average stretch, would be in Muscatine County, and then what the number is on that stretch of road, and it's gonna be astronomical. It's gonna blow your mind how much money's been spent on that road. And I'm talking materials, I'm talking labor, so.
And it's not, you know, and I think it's, you know, we have the compounding effect that I think you have some state areas, some public lands down there in that stretch of road that you have access to as well. And you know, it's not fair to the rural taxpayer to foot the entire burden for those, and I think that's the question I think we have to wrestle with
And
that.
again, if you do it for one, for example, if you're comparing them to Edgewater, if that is a fair comparison, they would expect the same.
I don't see how it's not, it's.
They would expect the same, right?
Right.
That would be a tremendous expense with that creek running along that side here.
Yeah.
So that's the latest, that's all I had for.
That's all I had as well. Bob, do you have anything else? Okay, Bob, committees?
Nothing.
I had last week, on the Thursday, the 6th, the strategic planning session that Kathy mentioned with the Eastern Iowa Mental Health and Disability Services Region. Forwarded a document to each of you guys, and Doug, I've asked Nancy to forward that to you and to Santos as well, since I don't have your direct email addresses, I apologize. But basically, this last Thursday was kind of a 30,000-foot level meeting where we're reevaluating our concepts, talking about big issues, big opportunities, big challenges. One of the biggest, and it's not unknown to us at this point, is that it looks like the state is going to transition child mental health services onto the regions as well, as it previously been in the province of DHS. And unfortunately, it doesn't look, at least to this point, that they've included a new funding mechanism, which means our already overburdened regions are going to have to, at least at the present, deal with something that's going to cost millions and millions more dollars without being allowed to develop any more funding for that. So, in a way, we're a victim of our own success in that we've done pretty darn well with what we've got, and DHS hasn't. So they're looking to offload this responsibility onto us. But you know, I would encourage our representatives and the folks of you out there to encourage our representatives in the legislature to approve adequate funding, because you really got to address this funding piece before we can get out of lurching from crisis to crisis. Jeff, you? Committees?
Yes, I had the Regional Workforce Board on the 4th in Davenport, and then I had the EMA Commission on Thursday, the 6th, here in Muscatine. The EMA Commission, I think, you know, primary was to set budget, where the hope was to set budget for requirements for the next budget cycle, and that's been pushed off till January 10th for that meeting. They didn't have a budget put together, finding some inconsistencies in how things were charged in past administrations, so they're going through and trying to find out what line items are needed and what aren't, and how to put all that together, so.
Thanks for filling in for me too, Jeff.
No problem.
I appreciate it, man.
Matt?
I don't have anything this past week.
Thank you.
I suppose I'll fill in for you in January too, huh?
That's fine by me.
Number 11 is to receive information from county employees. Sherry, you're pinch hitting today? Or Leslie? Nothing? All right, then we'll move on to number 12, items with the administration office. Item A is action to affirm a fiscal year 19 Paul Coverdell Forensic Science Improvement Act 2 grant application in the amount of $2,020 for medico-legal death investigation training for newly hired MEI Tasha Wheeler.
Second.
We have a motion and a second. All those in favor?
Aye.
It is approved. Are there any other items with the administration office? All right. Anybody have anything else for the good of the order? If not, we are adjourned.
Very good.